I want to introduce you to Dr. Stephanie Bernik. She is the Chief of Breast Service at Mount Sinai West. She is a breast surgery specialist. She's also an associate professor of surgery at the Icahn School of Medicine at Mount Sinai. I have to ask you first, what is a breast surgery specialist?
I would say someone that dedicates their career to taking care of breast diseases. Most breast surgery specialists are fellowship trained. There's some people that go through general surgery and don't necessarily do a breast surgery fellowship, but really concentrate in breast if they have a real interest in the field. It's really a field that requires a lot of attention because there's so many changes, and you really have to dedicate the majority of your time, if not all your time, to really studying the disease and sort of making sure you're keeping up with the latest changes because things are constantly evolving. So that's what I would say. A breast specialist is someone that's really just concentrating. Their focus is on breast cancer and breast diseases.
And what made you decide to go into this field in particular?
So it's interesting. I didn't start out in my surgery training thinking I was going to do breast surgery. I was doing general surgery. I sort of knew I wanted to be a specialist. I really liked the cancer care. But there was something about breast patients and the emotions involved with it that really drew me to the field. So I think, I knew someone who was a year or two ahead of me that was going into the field, and she sort of introduced me to the field. She was doing some research in the field. She ended up doing her fellowship at Sloan Kettering. I followed her actually a year later. But it was really conversations I had with her that started my interest. And then, when you're trying to pick a field, you have to think about what you want from the field you're going into. And it really sort of checked all the boxes.
You've worked at a number of prestigious hospitals. What made you go to Mount Sinai, and what do you love about Mount Sinai? Because everyone I talk to who works there is just so passionate about where they work.
Right. Yeah. For me, I'd been at St. Vincent's, which was a pretty academic center. The cancer center actually was taken over by Mount Sinai, where I started my career. And that's downtown in Chelsea. Then I moved over to Lenox Hill because St. Vincent's was closing, and I had a good opportunity there. That was a little bit of a different path because it was a little less academic. And as I was there, I realized I sort of wanted to get back into the academic realm. Surrounding yourself with people that are really top of their field. It's a little hard being at a hospital that's not necessarily tied to a university or an institution. And staying on top of your game. So I came to Mount Sinai and was really impressed with the level of care here and the level of the doctors around me. Just they were everyone's a specialist. Everyone is top of their field. It's stimulating just to be in that environment, and there's a lot of opportunity for research as well. We have a breast fellow, so there's a little more training. I still work with residents. A fellow is someone that's specializing in breast, but we're happy to be able to train someone. We're sort of training future leaders, hopefully. There's just a lot more opportunity here, and everyone's really passionate about what they're doing. So really great atmosphere. They were also one of the main reasons I was coming here was they were about to build a breast center, and there were a lot of starts and stops, but we're about to open next week in October. So I'm really excited about that. And that was part of the draw to coming here as well.
Oh, so there's a breast center now coming to Mount Sinai West, because
Correct.
I went to the Dubin Breast Center uptown for my surgery and the follow-up oncology, but I was at Mount Sinai West for my radiation. So what is that going to mean, this new breast center at Mount Sinai West?
So we're going to have a breast center on 11th Avenue between 54th and 55th Street. We will have a breast center, so breast surgery, connected to radiology. We'll have our own dedicated breast MRI there. It's breast and spine, actually. And so we're not going to have the medical oncologist and the radiation oncologist in that building, but within a year or so, there will be a surgery center there as well. So patients will be able to do everything there. They'll be able to have their surgery there and see us. Inpatients will still be done at Mount Sinai West. So I'm not leaving the institution completely. But it's really going to be a really specialized center, like state-of-the-art equipment, new setting, new facility. Everything is going to be really hopefully very pleasant for the patients. You know, the atmosphere is going to be really soothing. We put a lot of thought into the way we organized it. You know, if a patient comes to see the surgeon, they can do their studies the same day. They can stay in their gown and just walk over to radiology because it's all connected. You don't have to go through the waiting area. So it's really going to be exciting to be part of it. And hopefully we'll be a premier center on the West Side.
One of the things I love about the Dubin Breast Center is when I go for my annual mammogram and sonogram, I get the results in minutes. I don't wait hours. I certainly don't wait days. And I have heard most recently, the daughter of a good friend of mine went somewhere else in New Jersey. She originally had a double mastectomy. She's pretty young to get breast cancer, and she was fine for a couple of years. And then 3 months after a visit to the breast center where she went, she found a lump. She felt a lump under her arm, and she went back and she went for a biopsy, and she waited almost a whole week. And that was hell.
Yeah.
That was hell for the entire family. So that's one of the things I love going to a breast center at Mount Sinai, is that you take that stress away from us. The other thing I'm curious about for the new breast center at Mount Sinai West, one of the greatest moments when I was just about to have this sonogram to see if I had a second cancer spot before my surgery. I was waiting, and someone came in and gave me a massage, and she was working on me. And someone came and said, well, it's time for your sonogram. And the woman who was giving me a massage said, no, we're waiting until we're finished with this, because I'm not finished with her. And you have no idea how, not only was it was so relaxing, but what a surprise.
Sure.
That kind of touch, just realizing that that's going to help you so much in the moment.
Yeah, I mean, that's the goal of this center. It's really to bring extra care to patients, because that's what they need. I mean, I think breast is very different than many other diseases. So we sort of know that you need to an atmosphere where people feel calm, a place where they feel they can go if they're feeling anxious. You know, we want to have a staff there that really understands what these women are going through, but we also want to have the supportive services available to help with that. You know, massage is wonderful. I mean, it's, you know, to relieve tension and sort of help people sort of focus on other things, or maybe not to focus on anything and just relax. So that is our goal. I mean, we're not going to have that in the first few months, but that's the goal of the center. It's really to be at that level and provide the extra services that make the difference.
It's amazing to me, the innovations that have rapidly happened in this field. What can we look forward to? What are we on the verge of?
So things are constantly evolving with this field. That is one of the reasons why I really love it. You know, it seems like every few months there's another major breakthrough. I think on the chemotherapy front, there have been a lot of changes. You know, we used to always do surgery first. We've moved into an era where we're often, if a patient needs chemo, we're giving that up front, because we found that there is potentially a benefit to that. We can, you know, use the surgery to look to see how the patient has responded to the initial rounds of chemo, to see if they need more therapy. So, you know, that's been a major change. we're doing less surgery than we used to. We're trying to be more thoughtful in what we do. Not everyone fits into like, a box. We sort of try to look at the individual, and we can individualize the care more so than we ever were able to in the past. I mean, we're at the point where often, not with every cancer, but with many cancers, we can look at the genetics of the cancer to sort of gauge what the best treatment will be. That wasn't happening, 10 and 15 years ago. So it's really changing. It's much better for women because we're sort of focusing in on the treatment for that helps them without maybe being too aggressive. When we need to be aggressive, we are, but sometimes we can do hopefully less surgery, less radiation, less chemo.
Tell us about your best day at Mount Sinai West.
I've had a lot of good days. I have to say that some of the best days are when you're having a rough day and then you get a patient that just comes in. They're like, I'm so grateful. They really want to thank you. They say that, you made a difference. It sort of makes you think about, that's really the reason you do it. I've had days where I come out of a room and I'm like, you know what, that's why I went into this field, like someone who's really appreciative. And look, there's a lot of breast surgeons in New York City, and I don't take that for granted. I try to give personalized care to each patient. But it's nice when they say that it wasn't just that you did my breast surgery, it's just that like you were able to help me on a different level, whether it be emotionally or, because anyone can do a surgery. I think, the important thing is to try to relate to a patient and hopefully help them not just through the surgery, but through the emotional aspect of the disease as well.
Tell us the importance of getting that annual mammogram. There's so many people who put it off over the last couple of years with COVID, and that could be a game changer.
Yeah, we actually did a study at Mount Sinai looking at that. We looked at, we compared patients from 2019 to 2020 and the rate of delays, and people definitely were obviously delaying their mammograms. But we found that when we compared the two years, that people that waited definitely had larger size tumors, which we know that happens. We know that there's problems when we delay screening. There's a lot of debate in the United States because the thought is that perhaps if you screen less often, you still won't affect outcomes, but meaning survival. They look at like sort of one endpoint, survival, but they fail to look at how that person got to the point where they're surviving. So if you catch a cancer at an early stage, perhaps that patient can save their breast, minimize the radiation. But if you find that cancer later, that patient might need chemo, might need a mastectomy, might need radiation on top of a mastectomy to get to the same endpoint. Meaning that if you catch it earlier, you can give less treatment. If you catch it later, you have to give more treatment to get to the same endpoint. So all that matters, and that's not factored into a lot of the studies that look at the screening of mammographies and whether they make a difference. And we certainly know as breast surgeons, we all agree, screening really matters. So we definitely encourage women to, start at 40 and do it every year. But some people and some groups say that you can start at 50, you can start at 45, you can do it every other year. We still stand by the fact that screening really matters and makes a difference.
I know every cancer is different and the growth is different, how fast it grows, but is there a difference if you put off your mammogram for months, or is it really putting it off from year to year? I mean, how precise do we need to be with this?
So look, if a few months in either direction may not make a huge difference, but each person is an individual. So I'm sure there are cases where it does matter. And there are other cases where it wouldn't have changed things. It's really hard to say across the board. But we do feel, if you take the study we did, people that delayed things for 5 or 6 months, there was a big difference in the staging when they presented.
Is there anything else you want to add?
No, I just think women should know the importance of screening. They should know that if they have concerns, they should talk to their doctors. If they feel a mass, they really should not hesitate to have a physician look into it. You know, a physical exam may not be enough. If there's truly a palpable abnormality, they need to get some studies. Especially, I think in younger women, sometimes if they present with a mass, doctors will often tell them they could wait a month or two, see if it persists. And we just see so many cases of young women that have cancers and they've delayed it because they thought their doctor said it was okay. Perhaps the doctor wasn't saying it's okay. They were saying, let's see if it disappears on its own. But sometimes when a doctor says that, a patient thinks, well, they thought it was fine, and they don't go back for 4 or 5 months instead of 1 or 2. And it does, that can change the situation, and it can affect the outcomes.
And again, we stress during Breast Cancer Awareness Month, particularly get your mammogram. As Dr. Stephanie Bernik just said, don't put it off. So please visit mountsinai.org/breast screenings and set up your breast cancer screening. Again, that's mountsinai.org/breast screenings. And thank you so much, Dr. Stephanie Bernik, for joining us.
Thank you for having me.